Good evening, everyone. My name is Brendan Hayes. I'm with the National Hemophilia Foundation, and I'm the Director of Education for Innovative Therapies. Good evening, and we want to welcome everyone tonight to the Hemophilia Treatment Now and the Future. This has been a four-part series that we've had in the month of October. I can't believe that we're winding down. We've actually had three great presentations. So we started with the gene therapy session. Then we had our innovative therapy session. Last week we did clinical trials, and tonight we're finishing it all up with communicating with providers. So now that we learned all about these new therapies, and we learned about a lot about clinical trials, and some of us may be interested in participating. Now we're going to talk about communicating with providers. So with that, I'm going to introduce our speaker tonight. Tonight's speaker is nurse educator Sandra Hibner. Sandra has a master's degree in nursing and a certification in hemostasis nursing. Sandra has been a registered nurse for over 45 years and worked as a coagulation resource nurse and hematology research coordinator from 1996 to 2019. Wow. At Dayton Children's Hemostasis and Thrombosis Center. Thank you so much, Sandy, for your commitment to the community for all those years. Let me keep introducing. Although Sandy retired in 2019, she remains active and connected with the bleeding disorders community. She's a board member of the Southwestern Ohio Hemophilia Foundation and Family Annual Meeting of Hemophiliacs in Ohio, better known as FAM Ohio. She is on the planning, she's a planning coordinator for FAM Ohio's annual family education weekends. And it's one of her most favorite roles that she has. In addition, she has served as the regional representative for the Great Lakes region with the National Hemophilia Foundation and is a former member of the Global Hemophilia Network Support Committee. I know we're in for a treat. Thank you so much, Sandy.
Thank you so much for that kind introduction. And I'm very happy to be back here with you again tonight. And I would like to say publicly again that working with all of you with the bleeding disorders, the patients, the families, was really a thrill for me. It was one of my treasures, and you're all heroes in my book. So now that we have all these new innovative therapies to choose from, we need to talk a little bit about communicating with our providers. And when I think of 45 years of communicating with providers, I could tell you some really stories, some good stories, but not tonight. But I can say that the communication has improved as we have moved forward. So the next slide discuss disclosures, and I have no financial disclosures to disclose. And then we want to talk about what are the objectives for tonight. And the objectives are to develop a basic understanding of approaches to communicate with your provider, gain knowledge of patients' rights and responsibilities. What are your rights and responsibilities? Become familiar with shared decision-making, a way to discuss things with your provider, to communicate. Develop an awareness of the provider's perspective, and apply ways to communicate with your provider in different circumstances. We'll have some case studies at the end where we're hoping you can put on your thinking caps and think of just communicate and just discuss different things that we could say or we could do when communicating with our provider. So Brendan, I believe you're going to jump in here on the next slide to talk about patient responsibilities.
Yeah, but before we do that, we actually have a poll that we're going to do just to kind of warm everybody up.
Sorry.
No worries.
So we do have a poll, and it'll come up and give you some selections to choose from.
Okay, let me see if I can give it a try here. One moment. We're having some technical difficulties, but let's see if we can make this work.
Ah, there it comes. I guess I could have read the poll, but everyone can read.
Yeah, absolutely. I'll give it just a little bit more time to get a few more people. These are anonymous polls, by the way, so
Don't worry about your answer.
yeah. Okay, let me go ahead and end the poll and let's see what results we get.
So our icebreaker question, what are you most concerned about when communicating with your provider? Choose one. Sounding like I don't have a clue about what I'm doing. Oh, it went off.
Oh, let me see. Whoops, sorry.
No one chose that. Offending my provider if I don't want to do what they suggest. 33. Oh my, look at these results. They're all the same. 3, 3, and 3. 33 for each one. Asking them to explain it to me again because I don't understand, taking up too much of their time. Well, those are all concerns that people have, and maybe another choice could have been all of the above, or whatever day of the week it is, you might have a different answer.
Absolutely. I think that's what I would have picked. All of the above. So let's talk a little bit about the patient's responsibility. So I think that when we go to see our providers, you know, when we get the information and we go back home, you know, there are definitely things that we all need to be thinking about. So I think the first one is being responsible for your own health. So really what this means is, you know, working with your provider to make informed decisions. So, you know, this is where, you know, just like the polling question, asking all those questions and not being afraid to ask questions, and not being afraid to maybe sound like you don't know what you're talking about. This is your health, and so it's really important for you to take control. And understanding, you know, the risk and limitations of your care. And, you know, I think it's important too for us all to remember that our providers are, you know, they're humans just like we are, and they make mistakes, and they may communicate in a way that we don't understand. So we can certainly, you know, be more responsible and ask those questions. The second point is to maintain a healthy lifestyle. And boy, is this one tough. I think that, you know, oftentimes we'll go see our provider for that checkup once a year, and, you know, he or she will tell us all the things that we need to be doing, right? And then we are driving home and thinking, yes, I got it. I'm going to do all the stuff I'm supposed to do. And then 2 weeks later, we sort of fall back into some of our old habits. So maintaining that healthy lifestyle, you know, practicing healthy habits to ensure that your body is functioning at its peak. And things that we can do are eating right, you know, being physically active. And you can be physically active with less time than you think you have. Even just going out for a 10-minute walk is better than sitting on the couch, right? And avoiding smoking and excess alcohol. Those are all things that we can do to have better health outcomes. Point 3, providing information about your health. So on this one, you know, I think this is another one where, you know, we sometimes get to our provider's office to that checkup, and we either don't want to disclose information or we forget about things that are bothering us. So it's really important to maybe keep a log that you can write down when you're experiencing things that you are curious about or concerned about, and actually review that and or create a list before you go to the doctor and take it in with you. I think, you know, Sandy, I mean, you may have a thought here about that, about how to actually, you know, how easy it is to forget all those things.
I agree. I just went to the doctor this week and forgot all about one of the immunizations I need to get before my daughter has her baby, and just totally forgot. So it's definitely worth writing down.
Oh yeah, for sure. Now, being fiscally and administratively responsible, this one is something that we also have to think about too, making sure that we understand our health plan, understanding what our co-pays and deductibles are. All of those kinds of things are really important to stay on top of. And then finally, being respectful of others, I think is important too. Making sure that when we're having conversations with our provider and the office staff, that we're, making sure that we are mindful that they're people just like us, and we'll get much better care if we're nice and kind.
So I think that another thing we could add to responsibilities, and which I found to be important, and it's kind of embedded in all the points that you mentioned, Brendan, was to be honest. We have so many wonderful treatments for bleeding disorders, but if you're not really taking your medicine as directed, you need to be truthful about that, and then figure out why, and that might be a way to bring up why we need to change the medicine because it's too hard for me to infuse or something like that. But a lot of times it got down to when you really couldn't figure out why a medication or a treatment wasn't working as well as it should, it wasn't being given the way it was prescribed.
That's a really good point. So for example, not being adherent to prophy. Yeah, absolutely. Okay, great. So let's go ahead and talk through quickly, what are the patient's rights? So we talked about responsibilities as a patient. Now let's touch on the rights. So as a patient, you do have rights, and some of these are protected by federal law. Some states also have additional laws to protect you as a patient. In fact, your state Department of Health may also be a resource for you as well. Healthcare facilities also have a patient bill of rights. Many of these are actually posted in common areas in your healthcare facilities and hospitals. And, I think it's really interesting to take a look at those and see what they're also, they want to ensure that you understand as a patient what your rights are.
I actually looked up on Dayton Children's website just to read them again because I had wanted to review them, and there was actually 23 different rights listed.
Wow.
Very interesting ones, even like your guaranteed help for absence, like if your child is absent too much, that you're guaranteed that someone from the hospital will help you through that situation.
Wow.
I thought that was interesting, and how if your child needs to be transferred to another institution, how they would go about that and how you would be involved and why that could occur. So there were quite a few. That's really interesting.
Another patient rights that we'd like to highlight too is that, an important thing to remember is informed consent. We touched on that a little bit last week, so we won't go into a lot of detail here, but it's your responsibility and your right to have informed consent. It's your responsibility to go through that with a lot of detail and make sure you understand everything and ask all the questions, and it's your right to receive that. And then finally, many hospitals have patient advocates that are available to help with problems. And so, we do have lots of resources, and that's one more for us. Mm-hmm. Anything else to add there, Sandy?
I think the State Department still has the I can't say it, ombudsman.
Yeah.
Ombudsman.
Yeah.
And it's as a resource if you need to check outside of the hospital. They also listed when they had on Dayton Children's with all of the rights, how you would manage your concerns, who you should call, and it was very detailed. So to give you some direction.
That's interesting. Now, just out of curiosity, those of you who are on the call, we'd love to hear from you. So if you have any thoughts that you want to add, in terms of patients' rights or responsibilities, please feel free to chime in the chat, and we'll be happy to read those if you would like to add anything.
And there was a time when I first started in nursing school years ago, you could not even access your own medical records. You could, another physician could access them or another institution, but they weren't given to the patient at all. Now that particular physician might give it to you, but if you know, it is your right to have that. If you want your own medical records, if you sign, and you actually even sign if you want another physician or another institution to have your records. Now you're in control of your records.
Absolutely.
That's a big change.
We actually have a question that popped up in the chat, and I am going to hold off on, we'll read this to Sandy as we get further into the presentation, but I think we're going to actually address a lot of those issues. So the question was, is there anyone who has experience where the healthcare provider doesn't seem to want to help because the case is just too complicated? So I think with some of our case studies that we're going to, we can talk through that as well.
Okay. Next slide. Shared decision-making, SDM, another acronym. Shared decision-making is a key component of patient-centered healthcare. It is a process in which clinicians and patients work together to make decisions and select tests, treatments, and care plans based on clinical evidence that balances risk and expected outcomes with patients' preferences and values. And when I thought through this, there's many different ways that shared decision-making occurs. And most hospitals or institutions now have some sort of plan, and they're teaching some sort of patient-centered communication. And you wonder, it's at this point, it's no longer considered to just be a patient's right to have effective communication. It's how it needs to be. And everyone accepts that this is a quality care, and it's a right for patients to have this effective communication. It's not just a nice thing, it actually is demanded. And what we found with effective two-way communication, when messages are negotiated until everything's correctly understood, is there's better outcomes, and the patients are doing better, and when they're more informed of their care and more involved. So it really behooves everyone to become involved. So I can remember one patient who, the family had 2 boys with hemophilia, severe, and unfortunately the parents had separated and were going to take separate vacations. So we were really trying to figure out how this was all going to work, because the mother infused the boys at home, but dad never had learned. So long story short, they had a very they drove to Boston, I believe, and stayed in the New England area. And dad had to drive the boys 2 hours each way to get their infusions at a local hemophilia center. And, it took a lot of coordination for everyone to make this happen. But our physician wasn't really aware of all this. And finally, when we got the parents together after the vacation, when they came in for the treatment, and they were able to communicate with the physician about what this all meant, mother knowing how to do it, father not knowing how to do it, father not being able to come in for the lessons to learn. Everyone discussed, everyone was totally honest, and they ended up choosing a different treatment that wasn't as hard on the parents. And it really was more than shared decision. It was like a family shared, and they were having trouble since they had separated, feeling like a family. But yet when they all came together and made decisions for their kids, it was positive in so many ways.
Wow, that's such a great example. Thanks for sharing that. That's really transformational for the children as well.
It was, and I think mom was holding on to the fact that she knew what to do and dad didn't, which might have been part of the problem. I don't know about that, but when everybody really shared what was going on and how they felt, it worked out better for the boys, for sure.
Communication is key.
That's right. Next slide. So types of medical decision making. Paternalistic information and recommendations. Back in the day, the doctor would have probably, this slide would have been a male doctor, but that's another story. But patients would come in and simply the doctor would tell them what to do. And the patients had really very little choice. And if they made a lot of discussion, they probably were looked upon as being a little bit of troublemakers. Excuse me. But it was very one-way communication, the clinician just telling the patient what to do. And then we got to informed medical decision-making, where at least we're telling the reasons of why we're doing things. And now we're talking more about shared decision-making. So it's a complete circle. The physician and the patient are sharing their concerns, their recommendations, asking questions, checking over the values and preferences. And the clinician isn't offering usually just one, this is what you need to do, period. The patient can ask, are there other treatments that could be available that I might utilize? And the clinician should be able to and willing to be able to give you that information and to work with you to come upon a decision that works for both, that helps what you need for the patient, but also that the patient can actually do. Because as we said before, all the treatments work, but you have to do them. So
absolutely. And I think one thing that we have to remember as consumers or patients is that at the end of the day, our providers want us to have the best care. They want to ensure that the care that we receive meets our needs. And it's really important for us to express what we need and what our concerns are and what's going to work for us. And if we're, if a provider suggests a treatment option that we know will not work for us, we need to be willing to stand up and say, can we maybe come up with something else? Because I just don't think this is going to work for me. So
definitely. And there are times when, this shared communication doesn't exactly occur in a very, medical emergency or something that needs to be handled immediately. We may not have time for all this, and the physician will be in charge and take charge. And that's what we want them to do as well. We don't want to dilly-dally around and discuss it when it's something that needs to happen right away. And all of the studies that have shown that having this type of medical decision-making, it's effective because it decreases the anxiety for the patient. And when you decrease the anxiety, you increase the adherence. And so there's better clinical outcomes. And once things start happening in a positive way, using this communication, it just continues to get better. Next slide. Shared decision-making, 4 priorities. Current state of the patient's bleeding disorder. What's going on right now? Next. Information already known by the patient and the provider. So what treatments are available? How much does each treatment, how does it work? What does it cost? What are the benefits? What are the risks? Patients' wants, values, and preferences. Patients often travel. Does the patient travel for work? Does the patient prefer treating less often? Patient training, maybe they want to do a marathon or they have some important event that needs to be taken into consideration. And I believe there's one more. And who else is involved and how? And that was kind of when I think about that family and their vacation plans, that kind of had all those components. Who else is involved and how? Is grandma involved? Or, there's, what is their family situation? There's just many, many different things to consider when making this, and getting to know the patient and their situation makes all the difference in the world. And how you communicate with families, is there cultural concerns, you need to be aware of, and that is keeping them from doing something or limiting them or maybe even helping them. So priorities. Next one. That's kind of what, is that the right slide?
Yeah, so that one, so the shared decision making is sort of that overall framework, right? And then,
Yeah.
this particular slide, I'm gonna sort of walk through this as a patient because this is really a framework or a tool to help us when we actually have conversations with our provider. And then we're actually gonna, after this one, we're gonna talk more about what things look like from the provider's perspective. So for patients, for us as patients, so the first thing to remember is to, and again, another acronym. So one of the ways that we can remember things is by having these acronyms. And so PACE, so the P, so presenting detailed information about how you or your child is feeling. So it's good to, again, write down, think through all of these symptoms and concerns that you have, and try to be as detailed and specific about the issues that you're seeing at home. Everything always looks a little different at home than it does when you go to the doctor's office, right? But, having that reference is really important. And, likely, your physician will be providing you with some additional information. So, listen and try to, understand exactly what they're suggesting. But the letter A, asking questions if the desired information is not provided. So if you need more information, it's that time, you have an opportunity to present. Your provider then provides some additional information. If that information isn't what you were looking for, doesn't make sense, ask more questions. And then the next letter is the letter C, so checking your understanding of information that's been given to you. So really what this would look like would be, okay, Dr. Smith, I think what I heard you say was I need to make sure that I am doing my prophy infusions 3 times a week. Is that what you said? Okay, and does it matter when I do them? Oh, you want me to do them in the morning? Okay, good. Just wanted to make sure that I got that. So that's an example of checking through with the suggestions to make sure that you really did understand them. And another thing that you can do too is to bring a notepad in and take notes. You're not going to remember everything that you're told, so it's good to jot some notes down, and you can do that during that checking phase. And then finally, at the end, expressing any concerns about the recommended treatment. So if you're still not sure, you don't think it's going to work for you, all of those things we've already covered, this is your opportunity to sort of, express those concerns before you leave the office. I think our natural inclination, Sandy, is to say, oh, okay, great, thank you. And when we still have those doubts in our mind. So I think, just remembering that, remember this acronym and remember the letter E, and expressing any concerns that you have are really important.
Yeah, I agree. And I think sometimes if you really feel that you're just not sure this is going to work for you or for your family, you might want to suggest that, okay, doc, I'll try this for 2 months and then I'll give you a call and let you know how it's going. And then we can reevaluate. Would that be okay? And so, the physician knows you're trying to do it, but you may, need some time to see if it works. And if not, then we have to go to plan B.
Great.
Next slide. So shared decision making has the acronym for SHARE, and the S is to seek participation. So I'm the provider, and as the provider, I should introduce the patient and the caregivers to this concept of choice. So the patient understands that they play a major role, and that I want to hear what they have to say. And the H is help explore and compare options. The healthcare provider will introduce the patient to the available treatment options and their risk, benefits, the knowns and the unknowns. And the patient should be provided with sufficient information to effectively compare the various treatments that have been explained. Or if they don't have the information right there, how to seek that information. The next is A for access or assess. Assess values and preferences. So encourage the patient to share their values, preferences, and goals regarding the treatment in order to better understand what treatment options may be a good fit for the patient. And again, here we look at values and we look at cultural values as well. Reach, the R is for reach. Patient and healthcare provider decide together, as we've been saying, on the best option, arrange for a follow-up appointment to evaluate. The decision may not take place immediately as the patient may want time to consider or reconsider. Look over the treatment information, and they may need to discuss with their family. So we just need to decide when we're going to reach the decision and how. Evaluate. The healthcare provider will monitor the implementation of the treatment decision, assist the patient with managing barriers to understanding of the treatment, and to work with the patient to determine if additional decisions will need to be made. So this is quite a bit shared decision making. I know when I went over it, I thought of the different motivational interviewing you may have heard of, just patient-centered communication, but they're all different ways in which this shared communication occurs. And it's just, very beneficial for institutions and to implement some sort of training in this. And hopefully the physicians and the staff have time to do that, to learn. And it may be a little bit different if you've been in healthcare for a long time. Some of it may seem like, well, we know that. What are you saying? But it's been studied and it's proven to have better outcomes when this kind of effective communication occurs. And I read a joint commission, I'm trying to think what that was. It was in 2015 and it was a joint commission survey. And I believe the gentleman who did the survey his name was Joshi. And they showed that most of the serious adverse events that occur in hospitals, something over 50%, were because of miscommunication. It wasn't that it was anything, intentional. It was just miscommunication between the provider and the staff and the patient. And one survey showed that 2 out of 3 people who leave the hospital were really a little fuzzy on what their diagnosis, why exactly they were there, which just seems that couldn't be. But when it's shown that it is, it shows that we need to try harder and work more to better communicate.
One thing that I'll throw in that's was really interesting. My mother recently was in the hospital, and it was really interesting for me as a patient advocate to watch the process. And I know that when we were in the emergency room in the middle of the night, the cardiologist that was working with us, he was all business and he was in a big hurry, and he was really giving a lot of information and really wasn't engaging a lot with us. And so, I asked him to please slow down, and that, I wanted to make sure that I understood and that my mom understood what was going on. Really interesting. And he did. He was like, oh, you're right, let me slow down. And then when she actually got into her room and she was interfacing with other providers, it was a completely different scenario where they really took a lot of time. They slowed down. And, one of the things that I noticed through that process was the importance of patient advocacy and having someone with you to help take notes, help ask questions, because you're right, you're fuzzy sometimes, and, there's a lot going on, a lot of information is being thrown at you. And, just asking them to slow down a bit, I think is really important.
Well, it's great that he did when you asked him.
Yeah.
Yeah, he knew he was going too fast, but he, who knows what he was
right
from,
Yeah.
So, yeah, good. So next slide. 2 perspectives, provider and patient. What's on your mind? Well, that's what we've been talking about today. So as the provider, I think I would say, some of the questions I would ask are, will this be safe for my patient? Will this meet the need that they described to me? Will this work for them? Is this going to cause any issues in the future? Is this going to be something we start but we can't finish? Where are we going? How will patient access this treatment? Is this going to be something they can handle? And do they know all the risks and benefits? And do we need to go over those again? As far as the patient, and I know with the bleeding disorders community, will my insurance pay for this? And if not, how much will they pay? It's not just a percentage, it still can be a lot of money. Is my doctor listening to me? You have to feel that you're being listened to. Am I happy with the treatment plan? Or is it at least a treatment plan that I know I need? You may not be happy about it, but that I can do, that I can engage in willingly, knowing the risk and knowing what I need to do. And how does this fit into my lifestyle? And then if it doesn't fit, can we change it? We have some case studies, and I think Erica is going to read to us a synopsis of our study, and we'll go from there.
Sure. Jeff is on prophylaxis treatment plan, but he wants to quit his job and start his own business to have the opportunity to live his life more aligned with his values. However, quitting his job will mean that he'll lose his health insurance. Because of this, he wants to explore other treatment options that are less expensive or less frequent. He recently attended a webinar where he learned about multiple new therapies that are currently in clinical trials, and he is interested in learning more. At his annual checkup at his HTC, Jeff tells his hematologist that he wants to try a different treatment and asks about the new therapies. His hematologist made him aware of clinical trial going on for gene therapy. If Jeff participated, it would mean that he could receive this treatment for free and would potentially no longer need to infuse. However, the time commitment required to participate in the trial may be a barrier. Jeff's doctor doesn't want him to rush into anything and be well informed before making such an important decision. Now, what type of deciding factors does Jeff need to identify for himself first before engaging in a shared decision-making with his doctor to find a treatment plan that worked for him? So what type of things do Jeff need to do before engaging with shared decision-making with his provider?
Thanks, Erica. So those of you who are on the call, you can unmute yourself and jump in and give us any suggestions that you have. Or if you want, you can put stuff in the chat, put your thoughts in the chat, and we'll be happy to read them for you. So yeah, this is an interesting one. We learned in the clinical trial session last week, one of the key reasons, that people are doing clinical trials on these new therapies is, just this scenario with the Jeff, that they can potentially get the treatment at little or no cost.
I think the provider, if I was the provider, I would be worried about a few things. First of all, is Jeff going to be a good study patient? Can he, handle all the commitments that would be needed to be in a clinical trial? And the provider might be a bit worried, what if the gene therapy doesn't work for him and one of his levels aren't sustained, and then he has started this new job and he doesn't have insurance, and now he needs factor, and he'll need factor for any injuries as well. So I think possibly the provider's thinking, what's plan B? What are we going to do if something else happens? So and probably really wanted to ensure that this patient understands everything involved with a clinical trial and a new therapy like gene therapy. So I think that he wants him to be, wants him to be well informed.
And that's comforting because, in this particular scenario, that's exactly what Jeff's thinking. What is what is a way to solve this problem that I have right now, and not thinking about, what are some of the obstacles that I might have to overcome. So it's great that the provider's thinking through all those. And so we had a comment in the chat from Jeff's perspective. Can he be active in running his own business if he is actively participating in the trial? So excellent point, Dawn. How is he going to take time away from his business to do all this, right?
Mm-hmm. And he needs to look at the protocol and all his commitments very carefully of the time constraints that he will have. However, if he doesn't have to infuse and all this is, paid for him, it might be a good option.
Absolutely. So does anyone else have any other thoughts that they want to add in here? Okay, if not, let's go to the next case study.
All right, Liam is interested in participating in a clinical trial for a new therapy to treat his blood disorder. He has done lots of homework on this topic and has a good understanding of the clinical trial process and the different type of therapy options available. Before Liam enrolls in a clinical trial, he needs to talk to his hematologist about which treatment he should pursue and how it will affect his current treatment plan. Liam takes off work and drives over an hour to attend his appointment with his hematologist. Once he brings up the topic of a new treatment, his doctor immediately gets a bit defensive and brushes Liam off with a comment about how much time they've already put into finding a treatment plan that works. Liam doesn't feel that he's being heard on his time or his time is being respected, as he did put in several hours of his own time into educating himself and took off to work to discuss the important topic with his doctor. Now, how can Liam turn this conversation around so that his needs are met before the end of his HTC clinical visit?
Let's see what we have in the chat. So everyone feel free to jump in and add any more thoughts on this one. I think that, a lot of time and effort, I'm sure from the provider perspective, Sandy, there's a lot of time and effort that goes into finding the right treatment plan, for a patient, and you get them on a particular plan and everything's going great. And this new therapy comes into play. And, I think the other piece too is the physician or nurse may know more about this treatment or may have other information that, even though, Liam has done a tremendous amount of, homework and really, did all that he needed to do or that he thought, he may not have all the answers. And so, I think from a provider perspective, I could see how this could be a little frustrating. But, do you have any thoughts on how we could approach the provider if we have this particular scenario?
Well, they both definitely need to see each other's viewpoint and acknowledge, that they both spent a lot of time, and how you could do that. I many times, if you just state, yes, we did spend a lot of time on this. I know you've worked with me for a long time, and I'm asking you to work with me further, something like that, and to the provider. But the provider should also acknowledge that the patient did do some homework and compliment him on that, and maybe add to, as you did your homework and educating yourself, did you think of this or that, or did you come across this or that? And are we able to think of that and give each other, compliment in some ways, or at least acknowledge that both of them really are working for the same thing. Even though they were getting off track a bit. I find many, go ahead.
No, you go ahead.
I find many times if you just acknowledge the bear in the room or the elephant in the room, like if the patient even said that probably makes you a little angry with me that I want to change after you've done all this, the physician will probably say, oh no, well, we'll talk about it. I mean,
Mhm.
people just want their concerns or acknowledged.
Absolutely. And we've got some comments in the chat. And so Alan mentions, maybe working or voicing his concerns about not being heard. Again, it's that all important communication, right? So just talking about letting him know, I just don't feel like you're hearing me. And then Dawn suggested that Liam needs to let the doc know that he appreciates his time, but let him know that he'd really like to share his why behind wanting to change treatment. And I think that is really important. Here's, again, it goes back to my values as a patient, things that are important to me. And so, explaining that. So much appreciated there, Dawn. And then Dawn also mentions that Liam could ask the doctor why he would not want him to participate in the trial. Is there something that isn't suitable that Liam really doesn't understand? So, asking those questions, really important. Great. Well, we have one more case study to do.
Sure. This time it's LaCandia. LaCandia has recently been diagnosed with VWD. She recently found out about a clinical trial for VWD at clinicaltrials.gov, and she wants to participate in to better manage her blood disorder. LaCandia calls her OBGYN to share her decision, and her provider stated she needs to come in for a consultation visit. LaCandia's OBGYN clinic days are limited to Tuesday afternoons and Thursday mornings. However, LaCandia has work commitments during those times that she cannot get out of to visit her OBGYN during her regular clinic hours. LaCandia's appointment was automatically scheduled by her provider's office coordinator, who would call LaCandia and tell her when her appointment was. The office coordinator usually sounded so busy, which made LaCandia feel uncomfortable, telling him why she could not come in on Tuesday afternoon or Thursday morning. LaCandia tried to talk to her supervisor at work to get the time off, but after the second time of doing this, her supervisor told her that she could no longer flex her schedule on Tuesday and Thursday due to their work demands. As a result, LaCandia missed her next 2 clinic appointments after they were scheduled. When LaCandia then called to reschedule, she could sense the irritation or annoyance in the office coordinator voice with her.
So next slide, so we can see the question.
Yeah. So what barriers was LaCandia facing in these conversations with the coordinator? At what point could LaCandia have expressed her concerns, and what could she have said?
I felt a little sorry for her. She tried to get out of work and thought maybe she could make it work. And many times we all do that. But being upfront about when you can be somewhere and or at least calling when you found out you couldn't would definitely have helped the situation.
I agree. It's that communication thing again. It just keeps popping up. So if anyone has anything in the chat they want to throw in, please do. So Erica spoke about or added in, being honest with your provider can help. And yeah, you're right. Just communicating, letting them know, again, this is just not going to work for me. Can we come up with plan B?
In summary,
yeah, go ahead, Sandy. Sorry.
I don't know if we decided who was going to do the summary, but I think in order to effectively communicate with your healthcare providers, it's important to consider, number one, your rights and your responsibilities as a patient. You have the right for this type of honest communication, shared communication. How can you participate in the shared decision making? You have to do your part, and then if they're not doing their part, you have to call them on it. And also, but in doing so, also consider the provider's perspective. You want to take it?
Sure. The management of ongoing care for bleeding disorder is an excellent opportunity to initiate shared decision-making. Prepare to actively participate in decisions about your treatment plan. I think we talked about that one quite a bit. And then self-advocacy is an important skill for ensuring your healthcare needs are met. And all of these scenarios and all of these examples really sort of showcase the importance of self-advocacy, most definitely. Okay. Now, I'm going to try to initiate the poll. And while I'm doing that, Sandy, I know that we had a question in the chat. I don't know if you're able to look at the chat, but if you could go in and answer, we had a question up at the very top. And then anyone else on the call, if you have questions that you would like to ask, you know, situations or, you know, please throw those in.
I believe you're referring to Joni Gonzalez.
Yes.
Question. Is there anyone who has had an experience where the healthcare provider doesn't seem to want to help because of your case being too complicated? I have seen cases that have been so complicated that many times they need to be transferred to some other physician or some other institution that has more experience with that type of case. Is that something you're, Joni, that you're asking? You know, you feel you're not getting the proper care, or they say that you're so complicated? I mean, I think if it's something that your healthcare team isn't able to handle, that they should be honest and or you should ask, where should I go to have my needs met if you can't meet them? And sometimes there are different places that are more experienced in a certain disorder.
Great, thanks so much. And I'm going to launch the evaluation. There are 6 questions, and so you can actually, there's a little slide bar on the side so that you can go through all 6. And so I'm going to launch those now. And you can also continue to put any questions that you might have in the chat. This is such an interesting topic. You know, I think it really showcases again that, you know, I think at the end of the day, we all want the same thing. Patients want good care and our providers want good care for us. And it's really important to open up those lines of communication, you know, be respectful and kind to one another, and, you know, really work on those communication skills and learning more and more about shared decision making. You know, you absolutely hit the nail on the head, Sandy, when you talked about how, you know, that evolution slide where we started with that very paternalistic view, and now we've moved into shared decision making where we're having this back and forth dialogue, which is really important. So we have another. I'm going to continue to leave the poll open so we can have a few more folks answer. We had another question that popped in. Any advice for when the providers and the patient have different goals and priorities?
I definitely think that if that's the way someone feels, that you have different goals and priorities, that needs to be discussed and brought up. I mean, and you can say, I feel like we have different priorities, and my priorities are, and maybe you can come to some common ground. But again, bringing it up to the provider, you know, would be essential. And sometimes hard to do, but I think once you find your voice, you can do it.
Absolutely. Okay. All right. Well, I am going to end the poll. And I want to thank everyone for being on the call tonight. I know it takes a lot of effort to log into a Zoom call after a long day at work, and we really appreciate you all being here. And Sandy, thank you so much for your excellent presentation tonight. It was really great to learn from you these last 2 weeks. Erica, thank you so much for walking us through those great case studies. And I got to say thanks to Marley Wetton, who is behind the scenes helping us with getting through all of these slides. So in addition, I'd like to thank our partners in education who are listed on this slide. And again, we really appreciate you all. Thank you for being here with us in October. We do have two, we're continuing these national series in the months of November and December. So please log on to the NHF website and see what else we have planned for you for the next 2 months. Again, thanks everyone, and we'll see you next week.
Thank you, everyone.